without you needing to do anything. So if at this point you just don't know who these people are or when and why they left SASH, just leave them there for now, and we'll fix it. Does anyone have questions about that? I didn't see any come up. Okay.
Nope, the chat area is clean. Keep going.
Okay. So, and if you're missing participants, we are completely aware of the problem, and we know it's a big issue. I know it's holding you guys up substantially, and I apologize for that. We're really working hard to get missing people back on caseloads, and like I mentioned previously, we have made some really good progress this week, and you should start seeing those people show up here soon. And if you have duplicate records, so this is kind of a tricky one, and I don't want to hold you guys up. Thanks, Amy. Sorry, duplicate records. I don't want to hold you guys up anymore being able to enter information on these folks. So you as a group will have to choose which record to work with and to enter data on. So my advice would be to choose the record that looks more accurate and more complete, and make a note of which BBO number it is that you'll continue to work with.
Matt, let me add a couple of things up in chat.
Okay.
Well, first, I just want to share a success story. Diana Rule said her main person has shown up in PHL, so she's very excited. So, yay for success.
Great. That's awesome. Yeah, I was really hoping that you guys start noticing some of those missing people, so that's awesome.
Yeah. Melissa Stockholm asked, can we enter information into care utilization by hand for now until we do get linked with patient ping? If so, who should be contacted to add a site, such as Porter Hospital or Helen Porter Rehab?
So are you asking like to update participant information with patient ping? Is that the ask?
It looks like the care utilization tab in PHL. Like, can we enter information at the care utilization tab by?
Yeah, of course. Yeah. Amy, do you want to show your screen in PHL where the care utilization tab is? Mm-hmm. Thanks. Yeah, so here you
a couple of hospitals or facilities that might be on this. So Porter Hospital is not on here, and Helen Porter Rehab. She's wondering who did she talk to get those facilities added to the list.
So the funny thing about this list is it's actually hard-coded into the system. And from what I'm told, it takes quite a bit of effort to update it. Let me see where we are with that with PHL, and if they're able to some resources to update that or change that. Yeah, because I have had a few people say that there are some missing facilities. And these types of requests, if when they do come up, if you could fill out the PHL suggestion jot form that we created, just so that these types of things don't get lost in the chaos.
Located on the SASH forum for people who are wondering if PHL.
Yeah.
On the SASH forum.
It's on the SASH forum in the PHL section.
Okay.
But I've made a note of that, and I'll see where we are with adding to that drop down. So thanks for your question.
People were asking larger, which I just did. Melissa Southwick also said transfers.
Yeah, so we don't necessarily track transfers manually. So Amy, if you could you go back to PHL where the care utilization tab. So under there, you can fill out admit date and then discharge date, and then save, and then you can add another one for the transferring facility, or yeah. Does that make sense? So we're not really tracking the transfer as an event. We're just tracking each respective facility.
So by like listing the discharge date from one, and then you add a new one and create an admit date for the next.
Right.
That's okay. Got it. Okay. There's another comment from Diana. She wants to mention how helpful Madeline was. Yay! When she had to manually back off a bunch of people. For anyone struggling with anything in PHL, I would recommend calling Madeline and going over it with her over the phone. Madeline helped me clean up my panel, and it is now excellent. Thanks again. I want to mention how helpful okay, that was a duplicate. And then Stephanie wrote in, Madeline, you can add Helen Porter Hospital, which is good.
Oh, okay. Great.
Yeah. Melissa Southwick said, Porter Hospital missing is pretty big. We need to get that in there, especially if Ping needs to be in there to document changes.
Okay.
Yeah, Grove and Addison is pretty big. So Stephanie said it's not hard-coded. They can add it, which is good. We just showed it. Okay. Thank you. Same for missing physician offices. So it looks like there's also some missing physician offices in there.
Okay. All right. And yeah, if you notice other facilities that need to be added, please fill out that jot form so we can, so we don't miss any.
Okay. I'll go back to the agenda.
Okay. Oh, and as Diana mentioned, I am always happy to take your calls and your emails. So please, if you're having troubles, just pick up the phone. I'm more than happy to walk you through things. Okay, and with that, we'll just finish up a couple things with the duplicates. So if there isn't an obvious choice which record to go with, again, you'll need to decide as a group which one to work from. And as a rule of thumb, maybe you can choose the one with a lower last digit of their CBO number, just to make it easy. Okay. So that was my staff update email from last week. I had also mentioned that since caseloads really are still kind of messy, if you know when you go into PHL who you want to enter information on, you can navigate or you can search for that participant from the home screen. So Amy, if you could bring up PHL again and go to the home tab. And so it's a lot easier to search for people from this screen. You can just type in the participant's info. You can even just use their last name, and it'll bring up anyone on your caseload with that last name, and you can just click straight into their record. So just as a quick tip for making your PHL lives a little easier. Yeah, okay. And I did put on the agenda some of our PHL SASH resources. I think it's just good to bring this up we do have those desk aids that Amy created, and they're really, really useful tools. They're on the SASH forum. All of these resources can be found on the SASH forum. And yeah, thanks, Amy. Yeah, so we've got desk aids on all of the more difficult processes in PHL. We also have these Q&A call recordings. So if you wanted to go back and see something that was demonstrated, you can go back and watch it again.
Yeah, those are right. Those are right here.
Mm-hmm.
And see down here. This is just our third call. There's a question from Kenneth Russell. Any updates on multi-panel access?
Updates on multi-panel access? Kenneth, yeah. Can you explain a little more what you mean by that?
I'm guessing he means if you have access to more than one panel, being able to get access to more than one panel and having all of the participants on there. Correct me if I'm wrong.
So if you have, if you have multiple panels, you should already have access to them. And if you don't, you can reach out to me directly and we can get permissions, give you permissions to that panel. I hope that answers your question, but we do have that functionality.
Awesome.
So we are, okay. So now we're in the open Q&A part of this call. So we'll go back to the updated spreadsheet showing when participants were due for reassessments. So I think this is the scheduling functionality in PHL. And I don't have an update for that. It's not something that PHL is working on right here and now. So unfortunately, I don't know when that's going to start. What am I trying to say? It's something that they'll be able to start working on. I think that it's going to be a first quarter issue when they start tackling that. And correct me if I'm not talking about the same thing.
No, I think I haven't seen anything in the chat, but let me go back up to that question. And it says here, I was wondering if and when we would get an updated spreadsheet showing when participants were due for reassessment. I think this is also connected, Madeline, to the fact that people want to be able to run a report from PHL that has a list of all of their current participants, and that's not possible yet. And that maybe from that report, they could see when reassessments were due, like when they had their initial assessment or their last assessment.
Yeah, and the big thing that's holding us up on a lot of this is the caseloads still not being at 100%. So once that happens, I think a lot of these pieces will fall into place.
Okay. Well, hopefully that answers your question, Kathleen, in terms of the spreadsheets, because I think this is something that most, if not all, staff want right now is that list, so that they can look at it, run reports, and make sure it's current, and kind of use it as a touch point for some of the other work that they have to do. Kathleen says, yes, thank you. Okay, good. So that's what her question was. We answered it.
Okay. Yeah, and once those caseloads get up and running, and I'll also be able to start running those monthly reports that you were all used to getting.
If there's any other questions people have, I've tried to unmute folks, and then there's background talking, so I'm not going to unmute anybody at this point just to make it easier. So if you do have any other questions or burning things that you wanted Madeline to answer, just type them in the chat. It seems to be a really great way to kind of get the questions out. Okay, Emily, you wrote that you're sorry if you missed this topic. I don't know what topic you're talking about. If you had a question about something we discussed, please type it in. Oh, here we go. Are we going to be using my today's encounter? I don't know what that is. Do you know what my today's encounter
is? That something in PHL?
Assuming it is. Oh, right up here. My today's encounter.
Oh. To be completely candid, I don't really know what that is. It might be something that we start using once we're kind of past this phase of functionality not being where we want it. I can certainly ask PHL what that is, and we can decide if it's something that SASH could use.
Emily was guessing that it might be used for when there's billing involved. So.
Oh, that's a good guess. Yeah.
Yeah, and it might be for scheduling purposes and that kind of thing.
Yeah.
Diane, when do you hope for us to have the majority of the flu immunizations in? Any specific timeline?
Any specific timeline to have the immunizations documented in PHL?
Yeah, I believe that's
yeah, so in an update that I sent out a couple months ago, perhaps, or maybe a month ago, we were asking people to get all backlog data in by the end of the year. So I think that would be kind of falling under that, if you could get all of that documented in PHL by the end of the year. I'm assuming these are flu vaccines for this flu season.
Yeah.
So I would think a month is reasonable, I hope.
And yeah, we follow up. Can I delete immunization if it is a duplicate, or a person said they had one, then come back and said no, it wasn't the one they thought?
Oh, okay. So immunizations cannot be deleted. If it's like a duplicate, you can overwrite it. So Amy, I don't know if you would go to the immunization section. There's also a drop down that I think it says status. You could switch it to no if you added it, and then they later told you that they misspoke.
So here's the no status we were talking about.
Yeah. Okay. So that's what I would do.
Date, not a definite date. Okay. We've had a couple of, Melissa Southwick says she'd like all the immunizations in by the end of November, please. So she just wants them into PHL by the end of November. Okay, and Diana said yes for this season. And then Melissa Southwick wrote, Pneumovax wouldn't go into PHL, all the other immunizations worked. So there's only certain immunizations that are in here. Pneumovax is listed in PHL, but it sounds like Melissa's saying we wouldn't put those in.
Yeah. And I think this list is used by a lot of other PHL customers, so I don't know if we can adjust this list.
Okay.
Wait, this is stuff. Can you hear me?
Yep, go for it.
Pneumovax, is someone saying that we don't record Pneumovax?
Yes, I think.
Melissa said she wrote that. And then she wrote, Beth is having trouble clicking on it and having it go through. So she's saying, no, she's not saying that. Sorry. The way it was typed, that's what it looked like. It looked like Beth was having trouble, that it wasn't going through, so it wasn't working. So let's try it.
It wasn't working. Oh, okay. Yeah, we'll check that. And that's something, yeah, okay, that the nurses, Christy and the nurses worked on this list. So this is specific to SASH. Okay, good. Just checking on that. Yeah, we'll make sure it works okay. Thanks.
Yeah, I'm putting each one in. We'll see how it works. Yeah, it looks like the Prevnar and the Pneumovax are working. So it may have been just a bug stuff. Melissa's saying, on my panels under immunizations, I often see a huge list and many flu vaccines dated early in the year, April or May, which must be inaccurate. And I'm not sure why. Can it be corrected? Can you try doing it without a date? So if you don't have a date, let's see if this was the date. Hold on. Yeah, it looks like you have to have a date in order for it to save.
Yeah. Well, you can still choose no and then maybe put the date that you assessed that it was not given.
And that's why they say approximate date. We don't really, from what I understood when we were going through this, is we didn't need a definitive date, but if we have like an approximate date, that's fine. That's why it says approximate there.
Right.
And Melissa, is it possible for those participants that they got their first assessment in April or May and someone said, did you have a flu shot the last flu season? And they put yes, and then they just didn't know the date, so they put the date of the assessment? Could that possibly be what happened?
I can't unmute Melissa, so I'm waiting for her to.
I know, to chat in. And just so people know how we calculate data on a flu season, the flu season goes from, I think it's basically considered August. Madeline can verify it. She hasn't done a flu season yet. I think it's like August 1st to May 1st would be considered a flu season for immunizations. And then that would be one flu season. Then after May 1st, then we close off a flu season for immunizations and start a new one starting August 1st again, so that you see, is it a new flu season for immunizations? So even though most people aren't getting their flu shot for a season in April or May, or they're really not, sometimes we're leaving a lag time for the recording of data, and that's based on, those dates are based on how registries and other places do record the data, just because we know sometimes there's a lag time in the recording of data. And there are sometimes, and nurses can correct me, but there's rare occasions where people do get two shots, two immunizations in a season.
Melissa typed back in. Beth, her participant knew she had a shot, but no clue when. Normally, Beth gives an approximate time. Then Melissa Stockholm typed it in. I'm not sure. I'm just seeing lots of dates that are inaccurate, and the dates are before I began with SASH. Maybe an explanation date put in when the reassessment was done. So it looks like there's some inaccurate dates. So maybe people are a little leery about putting in an approximate date.
Yeah, and the nurses have had a lot of discussion around that. And basically, as long as it's within that flu season, that's really all that matters, especially for a flu immunization that's going to get redone the next year. So we want to capture the fact that they had an immunization in that date. So if it was 2016, it really doesn't matter if they got it in October or April, because now it's gone. You know, it's just that they were immunized. I mean, it matters that you're more accurate in the current flu season, but historically, we just need to know there was an immunization, and the immunization registries are okay with that. So you can just put the first day of the month and that they did have one in that year. I think that's what's most important. And you can definitely, Melissa, I know, check with Christy Paleman on this if you're still feeling uncomfortable with that. But it's really just capturing that they did have an immunization in that flu season is the concept behind that. I hope that helps.
And Colleen Loper had asked what we said need to be in by the end of November. So Colleen, Melissa Southwick asked that all of this flu immunization information that has been conducted be in by the end of November. Okay. I'm trying to look back and see if there's any other questions. Hold on. Oh, somebody wanted to know, can I delete a goal that was entered in error? Madeline, are you there?
Yeah, sorry, I was on mute. I don't know. Let's check. This might be the same kind of thing where you may not be able to delete it, but you can overwrite it, or just check the status as like inactive.
So here's the goal. We click back in it.
Yeah, I don't think there's a way to delete.
There's not like a true or false one like some of the other fields have, like that it's still there. So what do they do? What should we tell people to do if they want to delete a goal that they entered in error but they can't delete it? What should they put?
So my first go would be to overwrite it if it's completely inaccurate. So like if you had another goal, you can save over that information. I think that's the cleanest way of doing it.
So just click on it and create the goal right over it.
Right. It's basically like editing it to be.
But you can't.
Try saving first.
So I can't. This is
I see that.
Won't let me click on it. I can click on the needs and barriers, but I can't click on the goal, so you can't save over it. So maybe that's something we could talk about offline.
What if you click clear up above? Okay, I think now you can.
No.
Okay. I'll make a note of that. And so there's no like inactive status or anything like that?
Nope.
Okay. 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 Thanks for bringing that up. I know we're still working on this goals and objectives. Or is this goals and services? I know we're still working on tabs to get them a little better. I think right now they're just a little basic and they don't really work with the way that we run these assessments. But I've made a note of that, and I will, was that Diana?
It might have been. It was towards the top of the stream. I don't know.
It doesn't matter. I'll update you all when we have that fixed. Yes. So for now, I guess you can't delete goals.
Okay. Diana had another question. I had a couple that told the wellness nurse that they had their flu immunization and told me that they did not get one this year. I'm going to go back in and clarify. Sometimes memories are not accurate. Yes, thank you, Diana. Please. How do you check as inactive? Can you check the box on the far right? Yeah, Melissa Southwick, this box on the far right, this is the box you're talking about, is connected to primary. So it's connected to this box here, I believe. You can't click it here. It has to be down here. So it looks like we'll get back to people on the inactive list. Inactive goals. Okay. It doesn't look like there's any other questions. I hope I got through all of them. There was quite a lot of back and forth about the immunization. So if I missed your question, please type it in the chat, but I think we got through most of the ones in there.
Okay.
So I think we might
20 more minutes on the call, but if we don't have any more questions, I guess we'll things a little short.
Yep. So should I show your agenda?
I'm sorry, what? Oh, yeah. All right, everyone. Thanks for calling in today on a holiday week. Thank you for all your awesome questions and suggestions, as always. And please let me know if you ever run into issues while you're entering data, or if you have any data-related questions. Have a happy Thanksgiving.
Happy Thanksgiving, everybody. Thank you.